very good morning to one and all. I am Dr. Chaudhary and I'll be presenting a very interesting case of sudden visual loss in pineal gland tumor, blindness due to the third eye. So pineal region tumors contribute to less than 1% of all primary CNS tumors, and the clinical manifestations resulting from them are mostly due to the anatomical relations. So the pineal gland is related anteriorly to the third ventricle and the aqueduct of sylvius, and inferiorly it's related to the midbrain and the brainstem. So, the clinical manifestations most commonly include the Parinot syndrome and the horizontal gaze palsies. It can also cause obstructive hydrocephalus and slowly progressive vision loss due to the obstruction of the aqueduct of sylvius, resulting in the setting of disc edema. So, in this, we report a case of sudden vision loss with pineal gland tumor associated with Parinot syndrome and 1.5 syndrome. So a 9-year-old boy presented to us with sudden onset painless defective vision for 1 week in both eyes with subacute progression. This was associated with vomiting and headache for 1 month along with an isolated episode of seizure 3 weeks ago. On examination, a visual acuity of nil light perception was revealed along with lid retraction suggestive of Collier's sign. The pupil was 5 mm dilated with sluggish reaction to light, and the extraocular movements were limited in abduction, elevation and adduction in right eye and elevation and adduction in the left eye. Both eyes revealed upbeating nystagmus with retraction of globe and convergence on attempted upgaze, as is depicted in this particular video, where we can see an convergence retraction nystagmus in upgaze with limitation of upward movements. So fundus examination was unremarkable, revealing a normal disc without any sign of pallor or edema. An MRI revealed an heterogeneously enhancing lobulated mass in the pineal region along with obstructive hydrocephalus and dilated third and lateral ventricles. At this point, a diagnosis of optic neuropathy, Parinot syndrome and 1.5 syndrome was made, and patient was advised definitive neurosurgical management. So 5 days from presentation, the patient underwent VP shunting, and on the second visit, 10 days, the patient had temporal pallor, right horizontal gaze palsy, and although the visual acuity was nil light perception, very surprisingly, the patient was complaining flashes of light. 45 days, the patient's visual acuity recovered and was improving to hand movements and light perception. On visit 4, it further improved to half by 60 and finger counting close to face. And 4 months from his first visit, the patient underwent craniotomy and partial excision of the tumor. During his final visit, the patient's best corrected visual acuity was 1 by 60, partial Parinot syndrome persisted, there was diffuse chalky pallor, and patient was advised low vision aids. So what is unique in this particular case? Pineal gland tumors are not a known cause of sudden vision loss. The proposed mechanism of vision loss is a dilated and anteriorly displaced third ventricle due to the obstructive hydrocephalus, which causes the compression of the optic chiasma, which is very closely related to anteriorly to the third ventricle, invaginating into it at the optic recess. A similar mechanism has been reported in a case report prior to this. So the clinical implication, this report highlights a unique mechanism of vision loss in a setting of hydrocephalus and ventriculomegaly. Prompt measures such as VP shunting might preserve and improve vision. And pineal gland, the take-home message should be pineal gland tumors can be a rare cause of sudden vision loss. Ventriculomegaly with displacement of the third ventricle can cause compression of the optic chiasma and result in visual loss. Thank you.
Thank you, Samir. That was a very interesting case. Picking up all the signs was very important, particularly, of course, there are multiple reasons why an imaging would have been done. What was the imaging that was advised? And
MRI was done, sir, initially with contrast.
Okay. Any localization you were able to give in the beginning when you were advising the MRI?
So the patient was actually referred to us by a neurosurgeon, sir, initially, and by Parinot syndrome, like Parinot syndrome is localizing for pineal region tumor anyway. Initially, we were not able to know the cause for the sudden vision loss, but after reviewing the literature, we came up that it could be possibly because of the compression of the optic chiasma due to the anterior displacement and dilatation of the third ventricle, because it resulted in improvement as well from NLP to 1 by 60 after VP shunting.
But the vision didn't recover significantly,
Not
considering that it was a fairly acute presentation, and one would not have expected such a severe vision loss to occur and a permanent vision loss to occur. But anyway, yeah, there are many things we don't understand. I think, Samir, that was a wonderful case. Thank you.
It was all wonderfully explained. Only as sir already said, the only thing was the history, it was very acute. So we expected it to be little chronic and the gradual
Actually,
vision
the
loss.
vision loss was over a 1 month, ma'am, and it worsened over like the last 1 week before, just before the presentation.
Okay.
Thank you, ma'am. Thank